Hello, and welcome to Live Healthy, Live Well, West Virginia. I'm your host, Dr. Lisa Costello, a pediatric hospitalist and assistant professor of pediatrics at the West Virginia University School of Medicine. Today, we'll be taking a little different approach to the show by answering some questions submitted by you, the viewers. We are going to discuss viral respiratory illnesses commonly seen in the fall and new tools available to best protect against them. So let's get started. The fall and winter tend to be known for increases in viral respiratory illnesses like RSV or respiratory syncytial virus, and influenza or flu. And within the past 2 years since the pandemic, we have SARS-CoV-2, or more commonly known as COVID-19. So what common symptoms do we see with these viral respiratory illnesses? And really they can be a little bit different, but really a lot the same. So we can see individuals get fever, cough, shortness of breath. There are some differences between the viruses though. With flu, people tend to have really bad muscle aches, really achy, and that's usually where we see a higher fever. With RSV, people really tend to have a bad cough, a cough that can actually last for up to 3 weeks or even longer. And they also note having a great deal of congestion. With COVID-19, some of the interesting things that we've heard people report and we've seen as symptoms are a loss of taste and a loss of smell. So really, if you're having any of those type of symptoms, it is something to consider getting tested because there's different treatments depending upon what virus you have. And we'll talk a little bit more about that throughout the next part of this show. And one of the questions that frequently patients or families ask me as a pediatric hospitalist is, how do these viruses spread? And really they spread in similar-ish ways, but most of it is through droplets. So someone sneezes, or we wipe our nose, or we rub our eyes, and then we touch something or we shake hands with someone else, and then we could potentially share those germs. And that is how many of the times these viruses are spread. And that's why when we talk about some of the ways to prevent the spread, it's really important to follow the measures being put in place, because we really want to try to limit how much we spread these viruses from one another, because they are very contagious. So let's go to our first question. So George from Hancock County asks, do viruses change over time, and why is this important? George, it's a great question. And the answer is yes, viruses do change. Viruses are living beings. We can't see them. They're all around us though, and there are thousands of viruses, and some that cause illness in people, some that cause illness in animals, some that cause illness in both. And over time, we can see viruses change. And I think this has probably become the most apparent to us as a community in the pandemic, because we've heard of all of these different strains of COVID-19, or the virus that causes COVID-19. And we've seen that really throughout the last period of time in the pandemic. But the truth is that other viruses change as well. So each year, the flu or influenza vaccine is made based upon strains of the virus actually in the southern hemisphere. So there are a group of scientists that's their main job. The name that they go by is epidemiologists. We've actually had an epidemiologist on this show before. And what they do, along with clinicians and hospital systems, to track how much they might be seeing symptoms or particular viruses in their community, they look at, has the virus changed over time? And the importance of that is we want to make sure that the tools we have in our toolbox are addressing the most current strains that we're seeing. And so it's really important to know that viruses do change over time. And that's important because the tools that we have to try to prevent them or to lessen how severe the diseases are for individuals really depend upon the way the virus changes. And so some common ways that you might see that be referred to as are variants or different strains of the virus. So it's a great question, George, and thanks for sending it in. Next, I do want to just touch a little bit about the difference between viral infections and bacterial infections, and what does that mean when it comes to treatment. So viruses and bacteria, and there's other different germs as we'll refer to them. And the difference is that with viruses, we unfortunately don't have many treatment options. So the best protection we have is to actually prevent the illness from happening at all, or to have our body have some protection if we would be exposed to that virus. Now, there are some times that a viral infection can then lead to a secondary bacterial infection, or people get a bacterial infection. And bacterial infections are usually treated with antibiotics. And so I think it's important for our viewers to know that there is a difference when it comes to a virus or a bacteria, and if your healthcare provider is providing a treatment based upon the symptoms that you have. So it's always important and recommended to reach out to your healthcare provider if you have questions, or if you're having any of those symptoms that we just talked about. It's important that you touch base with your healthcare provider to see what kind of treatment you might be able to get to help you feel better. I do want to share for our viewers a new resource that is available in West Virginia, and we also have seen some national resources available that is allowing people to kind of maybe know what is more in my community at one time. We just talked about how viruses can change over time. Well, in West Virginia, they launched what they're calling a pan-respiratory dashboard, and it replaced the COVID-19 dashboard. So in the pandemic, many of you may have seen different ways to track how much disease we were seeing in a community. And so this dashboard includes regular updates to the respiratory illness season and focuses on data that gives us the most accurate picture of the three main respiratory viruses that we're talking about today. So the virus that causes COVID-19, RSV, and influenza. So I encourage you to check that out if you live in the state of West Virginia, or if you live in another state, you could go to the CDC and they are able to track different disease activity and what viruses might be more commonly seen in your community. So now let's dive into talking about each of those viruses separately based upon the questions that we've received from viewers. So as a pediatric hospitalist, I care for children in the hospital. And what I commonly see in the hospital is RSV, or respiratory syncytial virus. RSV is actually the most common cause of hospital admission in infants in the United States. We also see RSV impact the oldest among us as well. In fact, individuals greater than 75 are also at very high risk of getting into the hospital. And so when we talk about RSV, there are groups of patients or people that are at higher risk of getting really sick if they get the RSV, the respiratory syncytial virus. And so as I mentioned before, usually you'll see a really nagging cough that patients and people just tell me, you know, this cough just would not go away, and a lot of different congestions or runny nose. And so individuals who are at higher risk are those who are really, really little. So if you have someone in your family or someone in your community that you know who was born premature, or they were born but before they would be considered term of 37 weeks along in their pregnancy, those children are really at high risk of getting really, really sick. And that's because RSV tends to get into the smaller parts of our airways and can really cause a condition called bronchiolitis, or in some cases also cause pneumonia. And that can really cause someone to work harder to breathe. So parents always ask, and I try to educate parents, what should they do if they're worried that their child may have RSV? Well, it's always a good idea to touch base with your healthcare provider. You also want to be on the lookout for symptoms. Is your child or the child that you're talking about, having a hard time breathing. Are they using muscles to have to help them breathe? Do they just look uncomfortable when they're breathing? It's very common in young children for the cough to be in fits where they cough a lot for a period of time, and there can even lead to breath holding spells. And really, if your child or your loved one are experiencing any of those type of symptoms, they really need to be checked out, including even perhaps going to the emergency department. The other thing to look out for is the baby, the infant, the child, are they able to maintain their hydration? Are they drinking? Are they eating for you? With really the important thing being drinking, because we want them to stay hydrated. For older individuals, you would be on the lookout for similar symptoms. If somebody's really short of breath or having a hard time breathing, especially for those people who have underlying lung conditions, those are symptoms that you really want to get checked out by a medical professional. So people frequently ask, what is the way that RSV gets treated? Well, really it's supportive care, in that if somebody needs a little extra oxygen, we'll provide oxygen to help them. Or sometimes, particularly in really little kids, they might need some extra help breathing. And that can be through a cannula placed in their nose, sometimes that's a mask, and sometimes it's even more intensive in that they need to have a breathing tube to help them breathe. So our next question comes from Kay in Putnam County, and Kay asks, is there a vaccine available to protect against RSV? And can you tell us about ways to prevent RSV in infants and older adults? Well, Kay, this is a great question, because actually this is something new that we have for the first time this fall of 2023. And that is, there has been a vaccine approved for adults. It was actually approved back in the springtime. And then more recently, we saw what we call a passive immunization, or a monoclonal antibody, approved for children. And the brand name, or the common name, the drug name for that is nirsevimab. And so we'll talk a little bit more about those, because this is really the first season that we're seeing an opportunity to try to prevent RSV. And so for adults, if you're over 60 years old, it's recommended that you get an RSV vaccine. The RSV vaccine is also recommended for pregnant people, particularly when you're in your third trimester. And what we've known from the different studies that have been done to prove the safety and effectiveness of this vaccine is that if you get vaccinated when you're pregnant, you likely will pass some protection on to your baby. So we know, as we just talked about, little babies and infants are at highest risk to get really severe disease. And so by the pregnant person getting vaccinated, you're going to spread some protection to the child as well. So what about the youngest among us, which I told you RSV causes it's the reason for infants to land in the hospital more than any other virus that we see here in the United States. And so this fall, for the first time ever, there's now the recommendation for this monoclonal antibody called nirsevimab, and it's actually recommended for all infants who are under 8 months of age. Additionally, we know that there are some people who are at higher risk to get really sick. We talked about that a little bit. Babies who are born prematurely, but also people who have lung disease or chronic lung conditions or a weakened immune system. They're also at higher risk to get sick even once they get a little bit older. Therefore, the CDC and the American Academy of Pediatrics have recommended that for those individuals who are at higher risk when they get RSV, they're actually recommended that they could get a second dose of this new monoclonal antibody in their second season of RSV up until 19 months. So this is a new tool in our toolbox to try to help prevent really serious complications from RSV. So with either the vaccine or this other monoclonal antibody, there's still the possibility that you could get really severe illness. However, if you get the vaccine or this passive immunization, you're less likely, highly less likely to get really sick or end up in the hospital. So really, the healthcare community has been really looking forward to being able to offer this to patients because we have seen the devastating impacts that the RSV has in our communities and on individuals, particularly those who are really young, particularly those under their first year of life and really within the first 6 months of life, and then those who are really at the other end of the spectrum, a little bit older. And so those tools in our toolbox, we hope, will really make a difference. So now let's shift to talk about a different virus, influenza or the flu. This is probably really commonly known. Most people talk about, oh, it's time for my yearly flu shot. And so as we mentioned before, the symptoms people usually have with flu are like the other viruses, but really you see really muscle cramping, muscle pain. You could even have the shakes or the chills along with a high fever. So how can you prevent this from happening? The best way to protect yourself from really serious symptoms from the flu is to get vaccinated. And so who should be vaccinated against the flu? Anyone 6 months and older should be vaccinated against influenza. Now, there are some different flu shots that I see. Our next viewer, John from Kanawha County, asks, why do we need to get a flu shot each year? Are there different types depending upon your age? And it's an excellent question, John, because there are different types depending upon your age. So for individuals who are older or over 65, they're actually recommended to get a higher dose vaccine. And you want to certainly talk to your healthcare provider about that. For young people, so individuals who are 6 months to even 9 years of age, they actually need 2 vaccines the first time that they're getting the flu shot. That's separated a month apart. And so it's really important to try to get protection before you would run into this virus or any of the viruses that we're talking about today. Vaccination works best if you get that protection before you come in contact with the virus in the community. And so that is the best way to protect against getting really sick from influenza. Some people ask, are there other treatments for influenza? So we talked about with RSV that we really unfortunately don't have many treatments available other than supportive. With influenza or flu, there is medication out there that if started very early from when you get the virus could help shorten your course and maybe help with some of the symptoms that you're experiencing from influenza or flu. So what should someone do if they think they have influenza or the flu? And I'm probably sounding a little repetitive here, but it's really talking to your healthcare provider and considering getting tested for different viruses. And there's actually tests available that focus on the viruses that we see more commonly in the fall that we're talking about today, the influenza, RSV, and COVID-19. And so when people have the flu and they get really sick, there are some warning signs that you should head to the emergency department or hospital. And some of those signs include really hard to breathe. Sometimes we can see individuals be really confused or have an altered mental state, and that might be due to their breathing. And also, if someone is appearing to be dehydrated, they feel so poorly that they're just not able to stay hydrated, then that's really important that they also seek medical care at the emergency room. So anyone who's really having a hard time breathing, you want to make sure that you get checked out and get the care that you need. And if you're feeling that way and you're alone, I would highly encourage you to call 911. You certainly would not want to drive yourself to a medical facility in that condition, as you wouldn't want to get into a car wreck or injure yourself or others. So for the remainder of the time that we have here today, let's talk about COVID-19. So we've heard a lot about COVID-19 over these past few years, And as we've discussed with the other two viruses, there are some other common symptoms that we would see more so with COVID-19, notably a loss of taste, a loss of smell, again, fever, cough, stuffy nose. There's also more that we continue to learn about COVID-19, including that some people have a condition known as long COVID or post-COVID conditions, meaning they have symptoms of all different parts of their body, whether it's headaches or what people refer to as brain fog, having a really hard time concentrating. They could have chest pains, long-term cough, muscle cramps, muscle fatigue, as well as joint aches. And there's other symptoms as well with our nerves or neuropathy, just a few of the symptoms that we're seeing with long COVID. So really, we continue to see that COVID-19 has impacted our communities and continue to impact our communities. And so who's at higher risk for severe disease for COVID-19? Definitely people who are older, and that's what we've continued to see throughout the pandemic, and even as we've moved into more of a recovery portion of this pandemic. We also know that people who have a weakened immune system, whether that's because they have a condition that weakens their immune system or they take a medication that weakens their immune system, those people are at higher risk for really severe disease from COVID-19. So David from Monongalia County asks, what is this 2023-2024 updated COVID-19 shot and why is it needed? So as we talked a little bit before, viruses change over time, and we've seen that a lot with the virus that causes COVID-19. So we know that COVID is an ever-changing health threat, and over time we've gained better understanding about the virus and the disease. So this 2023-2024 updated COVID-19 shots were created to provide our best protection against the newer virus strains circulating in our community. We know that immunity can decrease over time, and with an updated COVID-19 shot, our body's able to be reminded how to recognize the virus and even identify new strains so we can protect ourselves from some of the most serious COVID complications. Even if you do get COVID-19, being up to date on vaccination before you're getting the virus reduces your risk of severe complications, needing to stay in the hospital, or even dying from COVID-19. We also are learning more and more that getting an updated COVID-19 shot may also lower the risk of developing long COVID that we just talked about. Vaccination for COVID-19 is really important in the fall and winter when we see these respiratory diseases often spread. So COVID-19 vaccines are recommended for people ages 6 months and older, and it's really important to stay up to date on COVID-19 shots. So we've had a lot of questions, and we've had guests on before who've talked about COVID-19 vaccines, and we frequently get asked, are they safe or are they effective? And these vaccines continue to be shown to be safe. They've actually undergone the most robust monitoring in our nation's history. And we see their effectiveness in preventing that really severe disease or preventing individuals from ending up in the hospital. So really, of all the tools that we have in our toolbox, vaccination is the best way to prevent that really severe disease. So one question that I frequently get is, can people get the COVID-19 shot at the same time as others? So we've just talked about there's now a new RSV vaccine for older individuals, and there's the yearly flu shot. The answer is yes. You can get the COVID-19 shot at the same time that you get other vaccines. Again, always a good discussion to have with your healthcare provider. So people frequently also ask me, are there side effects from the vaccine? And with all the vaccines that we've discussed today, there can be side effects. The most common side effects for vaccines include pain at the injection site, redness at the injection site. You may have a fever, or you might feel a little achy afterwards. Some people don't experience any symptoms at all. It's important to note that getting those feelings after having a vaccine is an indication that your body is reacting to the vaccine and developing that immunity. One of the things that we've talked a lot about and need to educate more about is that if you've had COVID and recovered, should you still get a vaccine? And the answer is yes, because you want to update your protection, because as we've seen and discussed, viruses can change over time. There are some other treatments available if you get COVID-19, even if you've been vaccinated. There are antivirals that are available. Paxlovid and molnupiravir are the two brand names. And there's also medications that you could get if you are sick enough that you're in the hospital, or if you have access to a medication that was one of the first that we had, which name is remdesivir. And that is something that usually has to be given in a healthcare setting. So you certainly want to talk to your healthcare provider to see if you do get COVID-19, are there treatments available to help reduce the seriousness or the severity of your disease. So I think the last question we have is from Jay in Washington County, and asks, is there an easy way to find out if I'm due for a COVID-19 shot? The information has changed a lot since the beginning of the pandemic, and there actually is an easy tool that you could use. It's called the COVID-19 Vaccination Due Date Calculator. That's available at vaccinate.wv.gov. And if you go to that site and scroll down, you're able to do some very simple, answer some simple questions, including your birth date. Are you considered to be immunocompromised? Then there's a listing of some of the conditions that would be considered immunocompromised. And then you answer questions if you've received a COVID shot before, and if so, when you received that shot and how many. And then it will actually give you a calculation of if you're considered up to date or if you're due for a COVID-19 shot. And there's actually a way that you can find where a COVID shot might be located near you. It is a little different this season, so you want to call your preferred vaccination location to see if they carry the vaccine that you want and if they take your healthcare coverage. So we've talked a lot about different viruses today. So in closing, we really have a lot of tools in our toolbox. There's common things that all of us can do, like washing our hands, staying home when we're sick, or wearing a mask, or making sure that the air ventilation is good in a room if we're going to be indoors. Spending time outside can be helpful as well. Time and time again, we've seen that vaccination is our best protection from getting really sick from any of these viruses. So if you ever have any questions, talk to your healthcare provider and do what you can to keep yourself safe as well as those around you safe. So I want to thank our viewers for submitting so many important questions about the fall respiratory season. And I want to thank each of you for tuning in to Live Healthy, Live Well West Virginia on the Library Television Network.